Hi, Sea Crest families. Thank you for joining us. I am so lucky. We are also lucky to be joined by three Sea Crest parents who also work in the medical field, and they've graciously offered up their Sunday to share with us all their expertise in traveling and holidays around COVID. Best practices, tips to stay healthy, to stay safe, and most importantly, to keep our community safe. So we will go around and they will remind you who they are and what role they play. And we will give you some good tips as we navigate the next few weeks. Heather or Hannah, sorry, we'll start with you.
Yeah, sure. So I'm Dr. Hannah Walford. I'm also mom to two young boys. They are ages 2 and 5, our oldest of whom is in Mrs. Butler's JK class. His name's Will. And I'm an allergist and clinical immunologist. I practice at Stanford affiliated Menlo Medical Clinic. So happy to be here with you this afternoon.
Thank you. And Jessica.
Dr. Jessica Favreau already had some conversations with Lauren, which are also still available to view if you have those major questions from the beginning. Thanks to Lauren for being available on this Sunday. And, I know everybody as parents, none of us get Sundays off. So thanks everybody for watching this too. Very important topics and very important to address before all these holidays come in handy and come up upon us. So I'm an internal medicine physician at Stanford Concierge Clinics, and for both Hannah and I, these views are our own and not Stanford's based on the latest clinical evidence and data.
And Roxana.
Hi, I'm Dr. Roxana Irani. I'm a mom to Duncan in grade 3 and mom to Talia and also in Mrs. Butler's JK class. I am actually a high-risk OB specialist at UCSF, but I've served on many COVID task force for UCSF policies.
Wonderful. So let's get started with just that general. Right now, we're seeing a lot of people start to travel. Could you give us some tips, some guidelines about air travel versus car travel as we start looking at those plans going into the holidays and the longer breaks?
Yeah, I can start. So in general, we've been recommending to our patients to not travel if not necessary. So any non-essential travel should be avoided if we can. If you have to travel, then traveling by car and making planned pit stops at safe places that you know is more ideal than plane travel. Plane travel is probably your highest risk factor in going going anywhere in the United States right now. Certainly in the Bay Area, we have felt a little bit of a bubble. We've done extremely well with our numbers, but even for us, those numbers are starting to go up. In different parts in the country, you'll feel it very differently when you get there if you go. Numbers are starting to surge again. Many states have already gone on lockdowns number 2 and 3 for some states, and we hope to avoid that in the Bay Area. If you are traveling, we suggest traveling or getting tested 2 to 3 days before getting into a car and traveling or getting onto a plane and traveling. And then if you're traveling to somewhere else, getting tested 3 to 5 days after getting off of the plane is important, and trying to quarantine in those times before you're tested getting off of the plane. If you have to get tested, ideally you want to be tested with an RT-PCR test. If you happen to do a rapid test, any test is better than no test, but if you have the choice to select an RT-PCR.
Wonderful.
Just to segue off of that, the testing part, testing super important before and after. And then just a reminder that testing does not replace the need for the rest of the guidelines. So the wearing a mask, the hand washing, social distancing, limiting gatherings, trying to be outdoors as much as possible. So yes, testing, but yes to all the precautions as well.
And I will just add that I think in the media, we're hearing mixed messages about air travel, that it's potentially safe now because they have ionizing purifiers, but there are also cases of air flights of 59 patients coming down sick from one, sick contact on that flight. So I think the risk is still very real. Anytime you have people who are unmasked, eating and drinking in close proximity where there's shared air, the virus can be transmitted.
That leads me kind of to my next question, thinking about Thanksgiving in particular. If people are having guests over to their house or going to guest house, can you speak briefly about that meal? Should it be inside? Should it be outside? What are the best tips, even if it is a family member, but a family member maybe that you don't live with?
I can take that one. So for big meals like this, and a lot of people do the same for Christmas or any of the other holidays after Thanksgiving as well. The thing to remember is that family does not necessarily always equal household. So if somebody who's a family member who does not live in the home with you, they are not considered in your household. And so you need to have, as awkward as it might seem, need to have everybody wearing masks, or, preferably if they're coming to stay with you and then have Thanksgiving with you, having those people get tested beforehand, 2 or 3 days beforehand, being masked until test results are back or until they're actually there in your house with you. And then the safest way for the meal would be to have it outdoors. We're lucky enough to have this amazing weather right now. Hopefully that will stick around until Thanksgiving, but even if it doesn't, really, 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 I can't emphasize enough the eating outdoors. Big risk we've seen in work environments, in home environments, all the environments where everything is indoors. If you have to be indoors for some reason, if you're flying somewhere it's snowing, you can't be outside, being spaced out as much as you can from each other, putting the mask on in between bites, as silly as it seems, the more you can wear that mask, the better. Having windows open, if anything, to really circulate air, but really here outdoors is best. Trying to limit the number of people, trying to limit the number of households. Really the mandate is 3 households or less. Which again is if your parents live in a different house than you, and then your brother or sister and their family lives in a different house than you, that's it. That's your 3 households right there. So it's pretty limiting, and it should be. And, I think when it comes to, should it be a potluck? Should it be what of that? That's also higher risk. Having everybody else prepare their own meals and then bring them, that's higher risk. Really, if you can have one person preparing the meal, have everybody else be outside of that area where the food is getting prepared, that's best as well. If there's some scenario where you can have everything be individually served and plated, perhaps before, instead of having everybody share spoons, utensils, etc. Now's the time to not break out the silver, but to use those wonderful single serve utensil packets.
Can you give us a little bit of guidance? I know even for myself, I know that our county, and you touched on this briefly, our county numbers look pretty good, but nationally, it's really scary. I know California hit a milestone with 1 million cases, and we're seeing other states shut down. From your medical perspective, what does this mean for us? What does it mean for us in the Bay Area, in Half Moon Bay, at Sea Crest? Help us understand kind of what are we looking at in the next few weeks and months?
Yeah, I can speak to that. I think the time right now is really critical. I think more than ever before, this is the time to be careful. Just naturally with the holidays, we want to come together. Our tradition is gathering and traveling, and nobody wants to be the Grinch that stole Christmas. But right now we need to be really cautious because the virus is rampant. It's rampant across the country, and it's quickly becoming rampant again in our communities. So everybody who can take extra care to not expose the vulnerable populations, the elderly, if you're mixing households, if there are people with risk factors like obesity, hypertension, diabetes, people older than 60, I think you need to be extra careful and get tested and consider only meeting outdoors if possible. If you have to be indoors, opening the windows and creating an open air ventilation. Yeah, I think in the coming weeks and months, we are going to see an increase in cases. Other states have already gone into lockdowns again. And it's very possible that could happen again here. We're so close to a vaccine, but even once that vaccine is rolled out and gets FDA approval, it's going to take a very long time before we reach what's considered herd immunity, which is 70-75% of the population. So, the experts are saying maybe toward the third to fourth quarter of 2021, we may be reaching some normalcy, but I think in the coming weeks and months, the way we approach this virus is crucial. So people need to be wearing masks. They need to not travel if possible. They need to not mix households. And we're all in this together. So I know it's especially hard. We're all tired of COVID, and it's hard going into the holidays and the winter months. But now it's more important than ever.
That's, yeah.
Lauren, I just want to say, I think the three of us, as moms and as doctor moms, we all feel very confident in your protocols that you and your team have very thoughtfully approached for Sea Crest. We certainly feel obviously comfortable sending our kids in person. We recognize that there probably are going to be positive kids at some point. Likely they will be community acquired, and that is why it's so important for all of us as a Sea Crest community to be mindful of what we're doing outside of Sea Crest, because then we'll bring that into our school. And we are so fortunate to be open, and having kids in person, as we all know, is so critical to their development. So we just want to implore upon all of the parents to just be really thoughtful and mindful of not just their own family, but the Sea Crest community at large.
I think I speak for all the three of us doctor moms too. We consider ourselves at the high risk to our families, and so we take all of the precautions that we can between coming from work to home. And really, I mean, we haven't been out to a restaurant. We haven't seen any family because we don't have anybody locally since February. Does it suck? Yeah. But I think especially for those of us who have our essential jobs and who interact with COVID patients or people at higher risk for COVID, especially the vulnerable populations, it's not about even protecting us, it's about protecting everybody else. And I know that as the Sea Crest community, which again, super thankful to have, we all look towards that collective good, which is, I think, the great part of Sea Crest. And the collective good is us right now protecting each other. So we just have to keep it up. It's been a long time, but it could be even longer if we don't do the good work.
Yeah, and I think one thing that is especially troubling about this virus is the asymptomatic transmission. So the more reports that come out kind of showing that there could be a very high number of people who are transmitting it without knowing it, without having any symptoms at all.
Well,
so I think that's a critical piece. Yeah.
I want to say thank you. And as we are entering this season of gratitude, we have a week left before we break for Thanksgiving. I have such gratitude for the whole Sea Crest community that's welcomed me, and especially these three doctor moms who are first line workers. They are there, they are essential, they're keeping our community safe. We have a lot of people in our community that are really risking their lives for us. And a shout out to the Sea Crest teachers that want to come every day and serve our kids, whether it is on Zoom or in person. So to echo what they said, please keep up with all of the community protocols that you signed. If your child is not feeling good, do not push it and send them to school. Let us know of any exposure, and please be mindful of all of the work that Sea Crest has done over the last months to get to this point. We want to be able to welcome your children to our campus in between the holidays and after. And it really is that greater good calling. But I am so filled with gratitude for the moms on this call right now and for the whole community. So thank you so much. If you have any specific questions, please feel free to reach out to myself, and I will, if I don't know, because I am not the expert, I will reach out and get the answer from you. So thank you for listening, and have a very happy and very safe Thanksgiving break and holidays.
Yes, thank you. Happy Thanksgiving.
Happy Thanksgiving.